Have you ever felt short of breath, a tightness in your chest, or a cough that lingers longer than it should, and told yourself it must be nothing more than age catching up with you? Many seniors do, and it is one of the most common reasons breathing problems go unnoticed for far too long. A patient of mine once shared something I will never forget. She said, "Dr. Carter, I thought my breathlessness was just part of getting older. I never imagined it could be something more serious." For months, she confused her asthma symptoms with signs of COPD, and that misunderstanding kept her from getting the right treatment. Her story is not rare. In fact, it is far more common than most people realize. I want you to imagine this with me. You are sitting in your living room after dinner. The house is quiet. You haven't walked far, you haven't carried anything heavy, and you are not sick. Yet suddenly, your breathing feels slightly harder. Your chest feels heavier than usual. Your lungs feel like they are working just a little too hard. It is subtle, almost easy to dismiss, but it does not feel normal. That moment of discomfort carries a message that too many seniors overlook. Asthma and COPD can look nearly identical on the surface, especially in people over 60. They both cause coughing, wheezing, breathlessness, and fatigue. But inside the body, they behave very differently. Asthma involves inflammation that can often be reversed with proper care, while COPD involves long-term airway damage that requires a different approach altogether. When these symptoms are misread or ignored, the lungs and even the heart begin to work overtime. From years of caring for older adults, I have seen how easily these conditions blend together in real life. A small cough becomes routine, a little wheeze becomes background noise, and a slow walk to the mailbox feels harder than last week. These clues matter, and understanding them can change the course of your health. So stay with me. In the next part, I will help you recognize the differences with clarity and confidence. And before we continue, if this video is helping you understand your health, please subscribe, like, and share Senior Health Daily. Your support gives us the motivation to keep creating life-changing content for you. Why seniors often confuse asthma and COPD. As we grow older, breathing becomes something we pay more attention to, even when we don't say it out loud. Many seniors tell me they first notice small changes. A little breathlessness when climbing a short set of stairs, a lingering cough that shows up before sunrise, a quiet wheeze they hear only when the room is still. And almost every time, they assume it must be aging. Nothing more. But the truth is more complicated. Asthma and COPD share so many of the same symptoms that it becomes incredibly difficult for older adults to know the difference. Both conditions cause breathlessness that feels out of proportion to activity. Both can create a tight, heavy sensation in the chest that makes you want to sit down and catch your breath. Both can drain your energy, leaving you exhausted after tasks you once handled easily. The key distinction is often invisible. Asthma is rooted in airway inflammation that can improve dramatically with proper treatment. COPD involves long-term damage to the airway walls, usually from smoking or long-term exposure to irritants, and it changes airflow permanently. Yet from the outside, and even from the inside, the symptoms feel similar. I've met many seniors who came into my office convinced they simply had weak lungs. What they didn't realize was that the pattern of their symptoms told a deeper story. Some were having reversible asthma flare-ups, while others were experiencing COPD progression, and a surprising number were dealing with both at the same time. Understanding this difference matters because the treatments are not the same, and confusing the two can delay relief and even worsen the condition over time. Symptoms seniors commonly misread. So many seniors tell me they first noticed something was wrong through small, almost forgettable moments. A cough that lingers long after a cold has passed. A faint wheeze they hear only when the house is quiet. A short walk to the driveway, leaving them more winded than they expected. These moments feel minor, easy to brush aside, and that is exactly why they become so confusing. One of the most overlooked signs is persistent coughing, especially late at night or early in the morning. Many believe it must be sinus drainage or dry air, but coughing at these hours often reflects airway irritation that both asthma and COPD can create. Another subtle sign is wheezing that seems too soft to be serious. Seniors often say, "It wasn't loud, so I didn't worry." Yet even gentle wheezing means the airways are narrowing. Shortness of breath during simple activities is also frequently misread. Tasks like carrying groceries, walking a few steps uphill, or even bending to tie a shoe can suddenly feel harder. Some assume it's just muscle weakness or aging joints slowing them down, but the real issue may be reduced oxygen flow. Chest heaviness or pressure is another symptom that creates panic for many older adults because it resembles heart trouble. They worry about the heart but overlook the lungs, not realizing that inflamed or obstructed airways can cause the same tight, heavy sensation. Fatigue is perhaps the most deceptive sign of all. When oxygen levels dip, even slightly, the body feels drained. Many seniors believe they are simply losing stamina with age, but the deeper truth is that their lungs are working harder than they should. These symptoms overlap with aging, anxiety, heart disease, and poor fitness, which is why so many people misread them. Recognizing the subtlety of these signs is often the first step toward finally understanding what the lungs are trying to say. The science behind asthma versus COPD in older adults. As we explore the differences between asthma and COPD, it is important to understand what is happening inside the lungs on a deeper but still simple level. Imagine the airways as a series of flexible tubes that carry oxygen to every corner of the body. In younger adults, these tubes expand and contract easily, allowing air to move freely. But as people age, those tubes become less elastic, more sensitive, and slower to recover from irritation. Asthma is driven by inflammation that comes and goes. When something triggers the airways, the lining swells, the muscles tighten, and mucus increases. The key is that, with proper treatment, these airways can return to normal. That is why seniors with asthma often notice good days and bad days. Their lungs still have the potential to open up and perform well when cared for consistently. COPD tells a different story. Over time, exposure to smoke, pollutants, or long-term irritation creates structural changes in the lungs. Airway walls become thickened, mucus production increases, and airflow becomes limited in a way that does not fully reverse. This is why people with COPD often feel like they can never quite take a full breath, even on their best days. The lungs have lost flexibility, much like an old rubber band that no longer stretches the way it used to. For seniors, these distinctions are even more important. Natural aging reduces lung elasticity, and the immune system becomes slower to repair inflammation. This means asthma flare-ups can feel more intense, and COPD symptoms can progress more quickly. Reduced diaphragm strength makes breathing shallower, and the body must work harder to maintain oxygen levels. Another layer to this complexity is that many older adults have heightened sensitivity to allergens, weather changes, and irritants. What once caused mild discomfort may now trigger significant inflammation or airway tightening. This can make asthma appear more like COPD and COPD appear more like asthma, leaving many unsure which condition they actually have. Understanding what is happening inside the lungs helps seniors recognize why symptoms feel different than they did years ago. The more clearly they grasp the science, the more empowered they become to take steps that protect their breathing and improve their daily quality of life. Real stories showing how misreading symptoms causes harm stories often reveal truths that medical charts cannot capture. They show us how easily symptoms can mislead even the most attentive older adults, and how misunderstanding breathing problems can delay care at critical moments. One patient who comes to mind is a 72-year-old man who had been waking up several times a week because of a soft wheeze in his chest. He convinced himself it was age or maybe dry indoor air. He told me he would sit at the edge of his bed, waiting for the discomfort to pass. One night, the wheezing grew louder and breathing became harder, and his family rushed him to the emergency room. What he thought was mild aging-related breathlessness turned out to be an asthma flare that had been building quietly for months. Had he recognized the signs earlier, he could have avoided the frightening escalation that night. Another woman, a widow in her late 60s, believed that her morning cough was a sinus issue that came with colder weather. She never imagined it could be COPD. When she finally came in for evaluation, her lung scans showed significant airflow obstruction. She admitted she kept delaying the appointment because the cough seemed familiar and harmless. She told me later that she wished someone had explained that sinus drainage does not usually cause such persistent breathlessness. Once she began appropriate COPD treatment, she felt her energy slowly returning, and her mornings no longer began with coughing fits. There was also a retired teacher who thought she had asthma for years. Her inhalers helped sometimes, but not always. She described feeling defeated, wondering why her breathing did not improve the way it did for her friends with asthma. After a full evaluation, we discovered she had both asthma and COPD, a combination called asthma-COPD overlap. Once we adjusted her treatment plan to address both conditions, she experienced more stable breathing than she had in years. These stories highlight a powerful truth. When seniors assume their symptoms belong to one condition, or when they dismiss them entirely, they lose precious time that could protect their lungs and their independence. Understanding the difference between asthma and COPD is not just medical knowledge. It is a lifeline that can prevent emergencies, reduce fear, and give each person a clearer path toward healthier breathing. How aging changes lung function and masks symptoms. Aging has a quiet way of reshaping the lungs, often so gradually that seniors barely notice the changes. This is why asthma and COPD can hide in plain sight. The signs blend into daily life until they feel ordinary, even when they are not. As we grow older, the diaphragm loses some of its strength. It does not expand and contract with the same energy it once had. Breaths become shallower, and many people assume this is simply the rhythm of aging. In reality, shallow breathing can amplify symptoms of asthma or COPD, making it harder to recognize when something truly needs medical attention. The airways also become stiffer over time. They do not open as easily, especially during activity. A senior walking from the living room to the kitchen might notice they feel winded, but they attribute it to being out of shape instead of seeing it as a possible breathing disorder. I have heard countless patients say they thought they were simply losing stamina when the real issue was airway narrowing. Mucus clearance also slows with age. What might once have been a quick cough to clear the throat becomes persistent coughing that lingers throughout the day. Because this develops gradually, many older adults get used to it. They rarely question whether it could be connected to asthma or COPD. Chronic conditions such as high blood pressure, diabetes, or heart disease add another layer of confusion. Breathlessness is common in all of them. Seniors often try to guess which condition is acting up instead of realizing that worsening breathing might point to untreated lung inflammation or airway obstruction. I remember an 80-year-old woman who blamed her increasing fatigue on her heart. She had lived with mild heart disease for years, so any sign of tiredness made her think her heart was struggling again. When we finally tested her lung function, we discovered that her asthma had quietly become more active. Once treated, her breathing improved dramatically and her energy returned. She told me she wished she had known earlier that her lungs, not her heart, were calling for attention. Aging does not remove the body's ability to warn us. It simply alters how those warnings sound. When older adults learn to recognize these subtle changes, they gain the power to protect both their lungs and their independence. Environmental and lifestyle triggers. Seniors don't notice. Many seniors are surprised when their breathing worsens inside their own homes. They often imagine asthma or COPD flare-ups happening outdoors during cold weather or heavy pollution, not while sitting quietly in a familiar living room. Yet home environments are often filled with subtle triggers that slip beneath awareness. I once visited a patient who wondered why her breath felt tight every evening. Her home looked spotless. The carpets were vacuumed, the furniture polished, and the air smelled fresh. But that fresh scent turned out to be a powerful irritant from an air freshener plugged into the wall. Each time it released its mist, her airways tightened just a little more. She never suspected the product that promised clean air was the one making her lungs struggle. Dust can be another silent problem. Even in tidy homes, dust settles deep into carpets, curtains, and upholstered chairs. For seniors with aging airways, those tiny particles can spark inflammation that leads to coughing or breathlessness. Many older adults simply assume the coughing is due to dry weather or a mild cold, not realizing their lungs are responding to a daily irritant. Mold often grows in places no one checks. Behind the refrigerator, under a bathroom sink, inside an old air conditioning unit. When mold spores circulate, they irritate both asthma and COPD, and the symptoms can masquerade as fatigue or just getting older. I remember a man who believed he had developed a smoker's cough, even though he had quit decades earlier. Hidden mold behind his bedroom wall was the real cause. Pets also contribute in ways seniors rarely expect. Even beloved dogs and cats shed dander that floats through the air and sticks to fabric. Seniors who have lived with pets for years sometimes forget that their lungs can become more sensitive over time. Lifestyle habits add to the challenge. Cooking without ventilation fills the air with fine particles that linger long after the meal. Cleaning sprays release fumes that irritate the airway lining. Scented candles, perfumes, lotions, and laundry products all contain compounds that can trigger inflammation. And during winter, dry indoor air can make breathing feel rough and strained, especially for those already dealing with asthma or COPD. Even inactivity plays a role. When seniors spend long hours sitting, the lungs do not expand fully, and mucus can settle. This creates a cycle where reduced lung movement leads to more coughing and discomfort. The truth is that small changes in the environment and daily routine can create big changes in lung health. Many seniors only discover the connection after tracking their symptoms. When they notice that breathing becomes easier outdoors and harder indoors, the pattern becomes clear. A home should be a place of comfort, not a hidden source of inflammation. With a little awareness and a willingness to look closely at what is around them, seniors can reclaim control over their breathing and create an atmosphere that supports healing rather than irritation. The heart-lung overlap that makes symptoms confusing. One of the biggest challenges seniors face is understanding whether their symptoms come from their lungs or their heart. These organs work as partners, and when one struggles, the other feels the burden. This is why so many older adults misinterpret breathlessness, chest pressure, or fatigue, and often focus on the wrong cause. I remember sitting with a patient in her 70s who kept describing her symptoms as heart palpitations. She felt her chest fluttering and assumed it was a heart rhythm issue. But her oxygen levels were dipping each night due to airway inflammation, forcing her heart to beat faster just to keep up. She was convinced she needed new heart medications. What she truly needed was better lung control. This overlap creates confusion because the sensations are so similar. When the lungs cannot move air easily, the heart works harder to deliver oxygen to the body. That extra effort feels like pounding or racing. Seniors often tell me they feel it most when climbing stairs or getting into bed. They think the heart is acting up, but the lungs are the ones sending distress signals. Fluid retention from heart issues adds another layer of complexity. When the heart does not pump efficiently, fluid can build in the legs or lungs. Breathing becomes more difficult, and seniors assume they are experiencing a COPD flare or asthma attack. The truth is that both systems may be struggling, and understanding the relationship is key to giving the body what it needs. Even mild inflammation in the airways can cause subtle oxygen drops that the heart immediately compensates for. That compensation brings on fatigue, lightheadedness, and an uncomfortable awareness of heartbeats. Many seniors describe this as anxiety or just age catching up, but it is often a sign that the lungs and heart are not working in balance. This is why accurate diagnosis is so important. When seniors rely on guesswork, they risk treating the wrong problem. When they understand how the heart and lungs rely on each other, every symptom begins to make more sense. A calm awareness of this connection allows seniors to take earlier action, seek appropriate care, and protect both organs at once. Breathlessness is not something to dismiss. It is the body's gentle whisper that something deeper needs attention. How doctors properly diagnose asthma versus COPD. Understanding whether someone has asthma, COPD, or a combination of both begins with careful, compassionate evaluation. Many seniors arrive in my office feeling frustrated because their symptoms seem vague, unpredictable, or overlapping. They have spent weeks or months guessing, adjusting medications on their own, or blaming age. The real progress begins when we finally measure what is happening inside their lungs. One of the first tools we use is spirometry. It asks the patient to take a deep breath and blow out as forcefully as possible. This simple act reveals how quickly and completely air can move through the airways. Asthma often shows airflow that improves with medication, while COPD tends to show more fixed narrowing. Seniors are sometimes surprised that a single breath can provide so much information, but it often becomes the key to understanding years of confusion. We also use bronchodilator response tests. After an initial spirometry reading, the patient takes a medication designed to relax the muscles around the airways. If lung function improves noticeably afterward, asthma becomes more likely. If the improvement is minimal, COPD or a mixed condition may be present. These comparisons help us decide which treatment will protect the lungs most effectively. Chest imaging is another powerful tool. A chest X-ray or CT scan can reveal structural changes in the lungs that suggest COPD, such as overinflated lungs or airway thickening. Imaging also allows us to rule out conditions that mimic both diseases, including heart failure or infections. For many seniors, seeing these images helps them understand why breathing has felt more difficult even when they tried their best to stay active. Allergy testing plays an important role as well. Asthma often develops or worsens due to allergens such as dust mites or pollen. When we identify these triggers, we give patients targeted guidance for their home environment. Seniors frequently tell me they wish they had known years earlier that something as simple as dust exposure was feeding chronic inflammation. Pulse oximetry and overnight monitoring offer additional clues. Even slight drops in oxygen can strain the heart and cause fatigue, morning headaches, or nighttime restlessness. These subtle changes often go unnoticed without testing, yet they reveal how well the lungs and heart are functioning under stress. The most meaningful part of diagnosis is the conversation. Seniors often share stories of breathlessness during meals, coughing during cold evenings, or fatigue that appears without reason. These stories help connect the test results with daily life, giving us a complete picture rather than a quick label. By the time we finish a full evaluation, many seniors finally feel clarity after years of uncertainty. They understand why symptoms appeared, which treatments will help, and how to listen more carefully to their bodies. Confusion fades, confidence grows, and with the right diagnosis, healing truly begins. Practical steps seniors can use to protect their lungs. Caring for your lungs in your 60s, 70s, or beyond is not about perfection. It is about small choices repeated with love and awareness. When seniors learn these simple habits, breathing often becomes easier, energy returns, and fear gives way to confidence. One of the most powerful steps is reducing exposure to irritants that inflame the airways. Many older adults live with dust, pet dander, cleaning fumes, or cold drafts without realizing how dramatically these irritants tighten the airways. Even mild exposure can trigger coughing or breathlessness, especially when the lungs are already sensitive from asthma or COPD. Creating a cleaner breathing environment often produces improvement within days. Daily gentle movement is another essential habit. As we age, the diaphragm and chest muscles become weaker, and the lungs expand less fully. Even 10 minutes of stretching or slow walking can increase lung capacity and encourage deeper breaths. I often tell my patients that movement is like a message to the lungs that says, "I am still here. Keep working with me." Correct inhaler technique is a surprisingly important factor. Many seniors use their inhalers too quickly, too softly, or at the wrong angle, which prevents the medication from reaching deep into the lungs. When they learn proper technique, the same medication they have been using for years suddenly becomes far more effective. Hydration plays a quiet but powerful role. Water helps thin mucus, making it easier for the lungs to clear irritants. When mucus becomes sticky and thick, both asthma and COPD flare more easily. Seniors who begin drinking more water often notice less coughing and smoother breathing within a week. Anti-inflammatory foods help as well. Leafy greens, berries, fatty fish, and warm herbal teas support lung health and reduce overall inflammation. These choices are not dramatic, but become transformative when practiced consistently. Many of my patients tell me that when they nourish their bodies better, they breathe better too. Regular checkups anchor all of these habits. Breathing symptoms can change with seasons, medications, stress, or age. Tracking patterns helps us adjust treatment before symptoms become severe. Listening to your body instead of ignoring small changes is one of the greatest gifts you can give yourself. Before we continue, if this video is helping you understand your health, please subscribe, like, and share Senior Health Daily. It gives us the motivation to create more life-saving content for you. These simple habits, practiced with patience, remind every senior that better breathing is not out of reach. It is built one mindful choice at a time. Red flags seniors must never ignore. There are moments when the body whispers, and moments when it clearly calls for help. For many seniors, the challenge lies in knowing the difference. Asthma and COPD can shift quickly from manageable to dangerous, especially when the lungs and heart are already working harder with age. Recognizing warning signs early can prevent long hospital stays, long-term lung damage, and heartbreaking emergencies that could have been avoided. One of the most serious signals is sudden or intense breathlessness. If you find yourself struggling to draw air in or out, or if each breath feels tighter than the one before, the body is telling you that the airways are narrowing rapidly. This is not a moment to wait. It is a moment to act. Chest tightness that feels unusual or persistent is another warning. Some describe it as a band tightening around the chest. Others feel a pressure that makes deep breathing uncomfortable. Seniors often mistake this sensation for heart concerns or simple fatigue, but when asthma or COPD is involved, this tightness often means the lungs are fighting inflammation or trapped air. Blue or gray lips and fingertips are signs that oxygen levels are dropping. Even if you do not feel panicked, the body is signaling distress. This requires immediate attention from a medical professional. Rapid breathing that does not calm after rest is another red flag. When the lungs cannot deliver enough oxygen, the heart tries to compensate. This creates a cycle of strain that becomes dangerous quickly, especially for older hearts. Wheezing so loud it wakes you from sleep or interrupts conversation is also a warning sign. Many seniors whisper to themselves that it is just a minor flare or a temporary reaction to cold air. But when wheezing becomes persistent or forceful, it is a sign of significant airway obstruction. These red flags are not meant to create fear. They are meant to create awareness. When seniors learn to recognize these warning signs, they protect their independence, their energy, and their ability to live fully. Each of these symptoms deserves respect and timely care, because early action often prevents the crisis altogether. As we arrive at the end of this journey together, I want to bring us back to a simple but powerful truth. So many seniors mistake the early signs of asthma or COPD for ordinary aging. They whisper to themselves that breathlessness is normal, that a tight chest is nothing to worry about, that fatigue is simply a part of getting older. But the body rarely speaks without purpose. These sensations are not random. They are gentle signals urging you to look closer and care more deeply for your lungs. What I hope you carry with you today is the understanding that improvement is possible. No matter your age, your lungs can respond to the right attention. Inflammation can calm, breathing can become smoother, energy can return. I have seen 70-year-olds rediscover the ease of walking across a room without stopping to catch their breath, simply because they learned to listen to their symptoms rather than dismiss them. I want to thank you truly for spending this time with me and with Senior Health Daily. Your trust means more than you know. Every minute you invest in understanding your body is a gift to your future self, a promise that you are choosing clarity and care rather than confusion and fear. Remember this: understanding the difference between asthma and COPD is more than medical knowledge. It is empowerment. It is the confidence to speak up when something feels wrong and the wisdom to protect your lungs and your heart with intention. If this video brought you clarity and comfort, I invite you to subscribe to Senior Health Daily so we can continue walking this wellness journey together. Your health, your breath, and your peace matter deeply.